of unity and an indicator of potential and possibilities, has never been a stranger to human history. Sports champions are made not by chance, but by choice. The choice of trusting science. Youthletics Limited Liability Partnership was founded in 2019. A year later, the company was renamed as Sports Nutrition Academy PLT. The Sports Nutrition Academy believes in sports nutrition and its role to optimize athletes' health, maximize their athletic performance, and help them to achieve their exercise goals with evidence-based practices. Being a pioneer in the industry, the company has helped more than 5,000 high-performance athletes, recreational athletes, and the general population in applying nutrition not only for better health, but also to achieve noticeable improvement in sports performance.
Apart from athletes support personnel such as coaches, parents, sports dietitians, sports nutritionists, sports scientists, and other allied professionals have also benefited with the experience and knowledge obtained from us. Our vision is to provide the highest quality, evidence-based sports nutrition practices, education, and services. To achieve that, we stand still with our 3E mission.
Engage. Empower. Excellence. The 3E mission drives the company's direction with an array of nutritional services.
We provide body composition assessment, weight management, dietary assessment, personalized menu planning, yearly periodization planning, and training observation for the athletes. We want to make sure that our services are specifically individualized based on the needs.
Education is simply the soul of a society as it passes from one generation to another. The Sports Nutrition Academy serves as a resource hub educating those who are interested in further enhancing their athletic performance through nutrition.
We conducted a series of physical seminars, webinars, and workshops spreading sports nutrition information, including pre, during, post-training diet, hydration tips, supplements, and doping, etc.
But today, the Sports Nutrition Academy has raised their game by digitizing education, producing sports nutrition courses that are certified by American Council on Exercise, the National Academy of Sports Medicine, and Athletics and Fitness Association of America.
This is considered our big milestone as currently we are the first provider of a structured and online sports nutrition course. We believe that everyone deserves the resource to improve in fitness, not only limiting them to elite athletes, coaches or sports nutritionists, hence recreational hobbyists, enthusiasts, parents, young athletes are welcome to get our education or service too.
Everyone can be their own champion. Every champion has their own secret to success. But of course, no one is born a champion. Champions are built and nurtured.
Hi and good evening everyone. Welcome to our second expert series in 2025 and thank you for joining us today. I'm Paula, your moderator for this session. While still waiting for the other participants to join us, I would like to take this time to introduce you what's new in our expert series 2025. This year, we are excited to bring you a new series of expert series with a lineup of 11 insightful sessions, each designed to tackle key sport nutrition topics. And the best part of our expert series 2025 is each session is just a 30 minutes bite-sized webinar, which perfect fitting into your coffee break or a quick learning session for you in your busy day. What makes this year's series even more special is that we are bringing in expert coaches from different sports to share their insights. This means you'll get sport-specific strategies tailored to the unique demands of different sports. We'll be also covering essential topics like nutrition for Ramadan in the last episode, menstrual health for female athletes like today, and much more. These sessions are designed to be practical, engaging, and immediately applicable. So be sure to catch up the full series. To stay updated with all our latest expert series, don't forget to subscribe to our snack newsletter by scanning the QR code here. The next thing is our snack membership. For just 89 ringgit per year, you can gain a full access to our exclusive lineup of 11 expert series, just like the one you're experiencing today, and on-demand access to last year's expert series that you can catch up at any time. But that's not all. You'll also enjoy exclusive discount and receive merchandise valued at over 300 ringgit. Think of it as your first step towards elevating your sport and health performance to new heights. And if you are ready to take the plunge, scan the QR code here to learn more and join our snack community today. Once again, welcome everyone to join us in our second expert series in 2025, Menstrual Health Among Female Athletes. In celebration of International Women's Day on 8th of March, this month's session highlights the growing recognition of reproductive health as a key consideration for a female athlete. Before we start, let me have a quick survey on who are the ones that joining us tonight. Please help me to answer the question in the poll in this Zoom meeting. Are you an athlete? Are you a parent, a coach, sports science medical team, or other health professional? Or none of the above? Our second question is, what is the most concerning gynecologic complication related to the relative energy deficiency in sport, which is also known as RES, or the female athlete triad? I can see we have some coach, some parents here. We also have other health professionals. Okay. Oh, we also have athlete here. So today, the session will be very fruitful for you. Then when we move to see the second question, we have three choices, and we have half for the loss of bone mass density due to reduced estrogen, and half of us also choose weight gain due to the increased appetite. Yeah, I wouldn't reveal the answer, but later our speaker, Dr. Jerilee, will be reveal the answer in the session later. All right. So, as I mentioned previously, reproductive health is increasingly recognized as a key consideration for female in sport. Menstrual symptoms, including like premenstrual symptoms, can affect the training capacity and significantly impact the sport performance of an athlete. However, communication barriers often exist between the athletes and their coaches, parents, doctor, nutritionists, and health professional, making it very difficult to address these challenges effectively. To shed light of this important topic, we are very honored to welcome our speaker today, Dr. Jerilee Azhary, a consultant obstetrician and gynecologist specializing in pediatric adolescent and adolescents gynecology at Pantai Hospital Kuala Lumpur. Dr. Jerilee is also a clinical scientist and researcher affiliated with the National Sport Institute of Malaysia, ISN, and the Malaysia-Japan Research Centre at the University of Malaya. Join us for this insightful session as Dr. Jerilee tackles key issues surrounding menstrual health in female athletes, helping them to break down the communication barriers and pave the way for them for a better support in sport. Before we begin, just a quick reminder, please stay muted throughout the session. And if you have any question, feel free to drop them in the chat box and we'll be addressing them during our Q&A session in the end. Without further ado, let's watch the presentation by Dr. Jerilee.
Assalamualaikum and very good evening. Thank you all of you for taking the time to join me on this beautiful Friday Ramadan night as we will be talking and discussing about female athletes and their menstrual health. My name is Dr. Jerilee Azhary. I am a pediatrics adolescents gynecology, but I also do general obstetric and gynecological work. I am currently affiliated to ISN or Institute Sukanegara, where I see and treat our national female athletes for their gynecological issues. Okay, let's get started. It is not without a doubt that the involvement of women in sports in Malaysia and worldwide is on a rising trend. We are seeing an increasing participation in traditional sports, e-sports, and female athletes are making strides in various disciplines. In our country, badminton, diving, cycling, and even gymnasts. And yet, we see a neglect in terms of reproductive health among women, not only women in sports, but women not in sports. We tend to focus very precisely on the athlete's performance, their muscle or bone injury, their nutrition level, their mental health, which is phenomenal for me. But we seem to forget that menstrual health is as important and that it can affect performance. Have a look at these women. These are the faces of sports in our country. These are incredible women who are still within their reproductive age group. As it is, majority of women in sports are within their reproductive age groups. It means they have fully functioning ovaries and uterus with full capacity of carrying a pregnancy and bear their own child. But for some female athletes, they do not seem to enjoy this phase of their reproductive life. They feel having period or menses is a nuisance. They feel disgusted with the menses. They feel annoyed and they hate their period. They feel they're just living it with it and just waiting for it to come and for it to go, and couldn't understand what period is all about or what menses is all about. Now, this is by far the most commonest question I get from the girls and women who comes to my clinic. Why do I have period every month? Why do women have menses every month? Why do we have to clean up ourselves every month when the menses come? Some of them just do not understand or do not have the knowledge as to why women have period. To answer this question, let's take a step back and understand the organ that is responsible for our menses, the uterus. The uterus, or the womb, is a female reproduction organ. It has two tubes or tunnel attached by its side or its body and two ovaries at the end of each tube. The uterus in a non-pregnancy state measures approximately 6 to 7 centimeters, but it can extend up to 40 centimeters and hold a life, sometimes two lives in it. And then it is capable of delivering a healthy baby. Uterus depends on ovaries and both the fallopian tube to achieve this goal. Therefore, the sole function of a uterus is to bear our own biological child. Without it, a woman could never carry her own genetically linked child. It is the only organ that can ensure the continuity of a nation. And yet, some women may be born without a uterus. Here is an article about a friend of mine who has what we call MRKH syndrome. That is a syndrome where no uterus was embryologically made. The only options for her is adoption. Now, let's move on to the ovaries, our power bank. The ovaries is not only responsible to store and grow our eggs, or medically known as oocyte, it also secretes and regulates hormone so we can live our day-to-day life. Let's take estrogen for example, the most popular female hormones. It has the benefit to protect our heart, our bones, boost our mood, improve muscle mass, and improve sex. And it does this with the help of its partner, progestogens. I do apologize for this rather messy slide. This slide is attempting to illustrate how menstrual bleeding happens. Inside the uterus, right here, as you can see, there's a room, and the room has got walls. These are the walls of the room. The walls are known as endometrial wall or the endometrial layer or lining. The wall thickens and sheds every month, and when it's thinned out, it will then shed as menstrual blood. The wall now being thin will then thicken up back again and the entire cycle begins. This diagram also shows the same thing of a shedding of an endometrial wall and thickens throughout the menstrual cycle as illustrated here. In other words, the uterus creates a new wall every month if no pregnancy happens. But why does it need to replace with a new wall every month? Because there is nothing wrong with having something brand new monthly, isn't it? This coming Raya, for example, like the year before and the year before, Muslims, not only in our country, Muslims around the world, shops for new clothes, new shoes, new curtains, new furniture, even new cars. I guess our endometrial wall wants to do the same thing. They want to produce something shining every month, but also a new lining meant if a pregnancy were to occur, or when a new embryo is formed, it gets to be implanted onto a new shining endometrial wall. It gets to move into a new home. But then again, not everything must be all shining and all new all the time. Sometimes old is gold. Let's move outside the uterus and dive into the ovaries. Let's talk about the eggs or the oocyte. When a baby girl is born, she has with her in her ovaries at least 1 to 2 million eggs or oocyte. She carries these eggs with her until she hits puberty, and half from the pool of eggs or oocyte will disappear or dissolve. As she moves through her reproductive phase of life, the oocyte in her ovaries numbers begin to deplete slowly. That would mean when the time for her to conceive, when she successfully is pregnant, the embryo is from the eggs that she has had in her since the day she was born. So, being a woman feels amazing, is amazing itself, but not everything can be perfect all the time. Now that we have understood the normal physiological changes in a female reproductive organ, let's talk about what is abnormal. In the next few slides, we will be discussing about some common gynecological disorders and how it may or may not differ between a female athlete and a female non-athlete. Before I do that, let's go through some common medical terms for gynecological disorders. Dysmenorrhea means pain during menses. Premenstrual syndrome or PMS are symptoms that a woman or girl may feel before menses that would affect her emotion or physical health. Menorrhagia is having heavy but regular menses. Metrorrhagia means having erratic and heavy menstrual. And amenorrhea would mean not having menses whatsoever. Oligomenorrhea are irregular or rarely having menses at all. These are some common gynecological problems that you might have heard of. For example, endometrial polyp, adenomyosis, which is the enlargement of the uterus, leiomyoma, also known as fibroids, endometrial cancer or malignancy or endometrial hyperplasia. They all are structural cause of AUB or abnormal uterine bleed. In a non-structural cause of abnormal uterine bleed, these include coagulopathy, there's a problem with clotting blood, ovarian dysfunction such as PCOS, endometrial causes, and iatrogenic, which is causes caused by medical treatment. And there's also a category where we do not know what is the cause, unclassified. So earlier, the slide before, we spoke about abnormal uterine bleed. I think I must also include some common gynecological problems that causes dysmenorrhea or pain during menses, which is endometriosis, adenomyosis, fibroids, and pelvic inflammatory disease or PID. When it comes to female athletes, the common menstrual disorders are not so much of abnormal uterine bleed. They have probably complained of amenorrhea, which is no menses, and primary amenorrhea would mean that she never had her menses at all. Secondary amenorrhea meant she had her menses and then it stopped. And oligomenorrhea, as mentioned before, she rarely has her menses. When you look at this chart, you can see that the gymnasts are one of the sports field that will conquer the top main complaint among female athletes having no menses, either primary or secondary. This is a recent paper published in 2022 which looked into the impact of competitive swimming on menstrual cycle disorder. A whopping 31% of swimmers reported no menses for more than 3 months, 22% no menses for more than 6 months, and nearly 10% reported no menses between 3 to 6 months. And when they do bleed, the menses found to be more profuse. With lower BMI, the higher the disorder of menstrual cycle. With the severity of the disorder of the menstrual cycle, the number of injuries among the swimmers were also found to be increased. This paper looked into what we call the female athlete triad. What is female athlete triad? The female athlete triad is a term describing low energy which can be resulted from disordered eating, menstrual dysfunction, and low bone density or osteopenia. It is considered a subset of the broader concept of relative energy deficiency in sports, or RADS. The RADS acknowledges low energy availability can impact various health and performance aspects in athletes in both gender. Now, in gynecological field, on the other hand, we also use a term called FHA, or functional hypothalamic amenorrhea. It is a common cause of secondary amenorrhea, and if you remember from my previous slide, it means no menses, and it is the key clinical sign for RADS. I personally find RADS a better term to use, for it includes a lot more than what the gynecological could see. However, the outcome that worries any doctor, regardless which term is being used, is the low level of estrogen. With loss of normal level of estrogen, the athlete can face menopausal-like symptoms which include brittle bones, or also known as osteoporosis. Again, I do apologize for another busy slide. This slide is to demonstrate that not all amenorrhea is caused by low energy deficit, which is caused by extreme exercise or eating disorders. A woman who had never had menses, termed as primary amenorrhea, may be born with no uterus or abnormal uterus, or even an abnormal sex chromosome. So that's why it is important that we perform an ultrasound of the pelvis to look at the condition of the uterus, as well as a karyotype to assess the sex chromosome. Other causes of amenorrhea also include abnormal thyroid function. Here you have hyperthyroidism or hypothyroidism, as well as high level of prolactin in the case of prolactinoma. There's also a cause of PCOS as one of the diagnoses for amenorrhea. In any cases, all women presented to a gynecological clinic with amenorrhea must first have pregnancy be ruled out before any further investigation is done. Again, as mentioned earlier, regardless if it is called FHA or female athlete triad or RADS, it can happen in any sports. It is high risk among athletes in the track and field or swimming, rowing, gymnasts, and figure skating. And also the prevalence of eating disorder among these three terms is around 16 to 47%. When these female athletes are seen in the ONG clinic, usually we offer some sort of hormonal therapy, calcium and vitamin D replacement, as well as we take the opportunity to rule out other causes of amenorrhea. This is just another slide for me to illustrate other causes of amenorrhea, which include things like chromosomal issues, having underdeveloped reproductive organs, causes from the pituitary as well. And here we have a variant of abnormal uterine formation. You have the unicornate uterus, bicornate uterus, uterine diadelphi, subtated uterus, arcuate uterus. Some women may not have menses because they are having some sort of treatment, whether it's birth control, chemotherapy, or sometimes stress, weight changes, poor nutrition. Obviously, PCOS is also one of the causes. And as I mentioned before, we always have to rule out pregnancy. Lactation and menopausal are also some of the common causes for amenorrhea. There are some gynecological issues which is quite unique to the female athletes. For example, abnormal uterine bleeding may be experienced by a female athlete in water sports. The entry of a high pressure water into the vagina can cause laceration to the vulva or the vagina. Bicyclist vulva is a condition where the vulva becomes swollen after being on a bicycle saddle for a very long time. And this is particularly seen in cyclists. There is also concern surrounding hymenal tear during training, during activities of the sports, so commonly termed as virginity. Athletes are always on the go. They have got things to do, they've got training to go, they've got camps to go. Therefore, it is important that the treatment they receive must produce quick recovery, which can be achieved via minimally invasive surgery if surgery is warranted. I do get asked regarding menstrual disorders or menstrual cycle among female athletes, and I have somehow divided into two categories. The common questions I get surrounding convenience in terms of having menses during sports and the performance that is affected by menses itself. So my next few slides, we will try to address these common questions. One of the most common questions I get regarding performance is that should a female athlete train during their menses, especially on day 1 and day 2 of their period? To be honest, the effect of menstrual cycle, especially on exercise performance, it does indicate there's a potentially low inferior performance during the early follicular phase of the menses when the estrogen level is low. This is when you compare with other phases of the menstrual cycle where there is a considerably higher concentration of estrogen as well as progestogens. So how does menstrual cycle with that fluctuating estrogen level can affect sports performance? Estrogen is an anabolic hormone. It promotes muscle strength. But whether or not these phases of menstrual cycle with the estrogen going up and down correlates with the athlete's performance remain debatable. In this study, they saw a very small effect size on the reduction of performance during the time when estrogen is low. So it's considered to be a trivial reduction in the athletes. So if you ask me, should I train normally on day 1 and day 2 of menses based on the previous facts of some research saying that the performance would be reduced? I would say yes. Why not? Unless you have other symptoms that may stop you from performing. For example, heavy menstrual bleed, pain during menses, or lethargy during menses. Next, we deal with conveniences during menses type of question, especially with swimmers. Tampons and cups are perfectly safe. Tampons are easy to use with high satisfaction rate, but there is a small risk for toxic shock syndrome or TSS, a form of bacterial infection. Cups, on the other hand, are more challenging in terms of inserting and removing, but the risk of leaking as compared to tampon is much reduced. Obviously, if you ask any female athlete they would want both. They want the convenience during their menses, and they want to perform well also during their menses. Some have sought out to the idea of, let's stop the menses, let's suppress the menses, so they can train every day. There are many ways to suppress or halt or stop menses, but most of it involve administering some sort of hormone therapy, either estrogen plus progestogens or progestogens alone, and it may be administered through many routes. For example, we can insert an implant under the skin or intrauterine device in the uterus, a vaginal ring, the patch, but the most common method is the pill. However, what if there is another method, another way, equivalent or better than stopping, halting, or suppressing menses? Many research done in the field of female sports compared between manipulation of menses by means of hormone therapy versus adapting to the natural menstrual cycle during sports or training. Therefore, here we will discuss the benefit of both methods of manipulating the menses with hormone therapy versus adaptation to the natural menses. The key player in relation to adaptation to natural menses is estrogen hormone. But there are other hormones that may also play a role in terms of enhancing sports performance. This is because estrogen, as mentioned earlier, is an anabolic hormone. It increases glycogen uptake and storage, therefore increase energy and power. Logically, during natural menstrual cycle, where there are phases where estrogen is at its peak, it may influence faster and more explosive aspect of the muscle performance. According to this cycle, at phase 2 and phase 3, where estrogen is at its highest point, it can improve high-speed strength and hand grip strength. The first pain threshold is also significantly higher during these phases. However, when the estrogen is at its lowest, usually at phase 1, the performance will naturally be also lower. Higher proportion of favorable top scores is also seen during mid-cycle or during ovulation or during phase 2 when the estrogen is at its peak. Therefore, according to this study, natural cycle adapting to it is best for recreationally active, trained or developmental athletes. Manipulation of menses by means of taking hormonal therapy with an aim to stop menses is not a bad option for some athletes because taking hormonal therapy is harmless and it gives great benefit if the athlete suffers from some degree of existing gynecological issues such as not having menses, having heavy menses, irregular menses, or pain during menses. In terms of performance, most studies did not find any differences between adapting to natural menstrual cycle versus manipulation of menstrual cycles with hormonal therapy. However, symptoms such as premenstrual symptoms, pain were much less among athletes on the pills. Sleep quality, mood, and fitness were also found to be more stable throughout the menstrual cycle. Many athletes, coaches, parents, and guardians are skeptical about starting the hormonal pills or any hormonal therapy on young athletes, and that is absolutely understandable. Let's look at the risks and benefit being on the pills. Hormonal therapy, such as the pills, is used to treat many gynecological and non-gynecological symptoms. It is used to treat acne, bleeding from fibroids, treatment of pelvic pain or dysmenorrhea or menstrual pain, treatment of excessive hair growth, termed as hirsutism, treatment of heavy menstrual bleed, termed as menorrhagia, and treatment of premenstrual syndrome or PMS. It also helps with regularity of menses, reducing heavy bleed and controlling pelvic pain as I mentioned before. Here, I like to highlight Hormonal therapies is also used to improve bone mineral density, related to rate S or the female athlete triad. Some very rare risk is involved in taking the pills. These include formation of clots in the heart, legs, lungs, or brain. There is a small risk for breast and cervical cancer, but these risks are extremely rare. Therefore, patients with higher risk for blood clots formation or risk of breast cancer will not be offered such therapy. So, if there is a question, how can I train with this pain? How can I train with this bleeding? Then yes, hormonal therapy will be very beneficial. Now let's talk about roles. Coaches, for example, male or female, must have adequate knowledge related to female reproductive tract to be able to identify gynecological issues among their female athletes. Please be aware, different girls or women have different needs. They have different uterus, different ovaries. Therefore, each athlete's gynecological issue should be addressed individually and case-to-case basis. Please avoid dismissing her period pain or missing her menses as normal. Clinical help is always available, so please feel free to refer her to a professional for help. Additionally, to all coaches out there, know your athletes. Besides monitoring their well-being in terms of mental health, sports performance, nutrition intake, do include monitoring of menstrual cycle and its accompanying symptoms. It will be very helpful for clinicians such as myself to make a more accurate diagnosis based on a diary on menstrual cycle, for example. For parents out there, your role is by far the most important role. You are the pillar of strength and support for your child. Give your child the support she needs in and out of sports. Empower them without expectation. And I must reinforce not to compare your uterus with hers. Learn and update your knowledge with reproductive health knowledge so we can take steps to identify gynecological issues and seek treatment early. As for myself and other sports clinicians, we must act now. We must be made aware that research and development in the field of sports gynecology is extremely scarce in Malaysia. Sports clinicians from different disciplines should work together in a multidisciplinary team approach, not only to identify sports injury, but also mental health and menstrual health. I love to add some kisah benar or true stories in all of my presentation. Let me tell you a few kisah benar. I saw a 25 years old female athlete in ISN around last year. She was complaining of severe menstrual cramps for almost 2 years and she's been taking painkillers every month. She would put this hot pack on her lower abdomen until her skin would blister. Whenever she tells her coach will say, sakit sikit ke tak mau main, tak mau competition. Okay lah, balik sajalah, keluar tim. These are the kind of comments that the coach will give her. She came to me and based on all the imaging, the ultrasound and MRI, we found that she's got endometriosis and endometrioma, a type of ovarian cyst that can cause pelvic pain. So we proceed on to do a laparoscopic cystectomy or a minimal invasive procedure to remove an ovarian cyst. After the procedure, she told me that she has no problem telling her coach about her sports injury, but she always have the fear to tell her coach about the period pain or even headache. She feels after the operation and when it was confirmed that she does have some issues, that is when her coach believed her when she says, I'm in pain. And they were a lot nicer. My second burner, I think I've seen this patient probably about 3 months ago. She's a 41-year-old Malay lady who is a coach. I saw her in ISN as well. She complained of severe, prolonged, heavy bleed. Sometimes she will have palpitation because she had lost so much blood. In fact, she was admitted to the hospital to control her bleeding, and she actually received a few pints of blood. to recover back the blood that she has lost. She was diagnosed with abnormal uterine bleed and was finally agreeable for hormonal pills. She was under my follow-up for a certain amount of months and she's doing well. And one of the things that she has commented after her ordeal is the fact that she became more aware of her female athletes' menstrual issues and she finally took their complaint seriously. Her advice to all coaches out there is to look beyond performance, beyond the social and lifestyle aspect. There is the female aspect. I'm assuming the female reproductive aspect, and only female has it. Anushka Parikh is an Indian badminton player. She was diagnosed with polycystic ovarian syndrome and she didn't even know about it. She had irregular menses, one of the symptoms of PCOS, and she was emotionally scarred and burned out from her promising career because of PCOS. And to all athletes out there, this is her message to her fellow athletes. Track your period every day, not just for 5 days. Track how you feel physically and mentally every day. Get to know the phase of the cycle of your menses and learn to train accordingly. And I love this line, these sentences, this statement that she said. Treat your symptoms. Period is normal, pain is not. Understand your symptoms and focus on resolving it. Find your support system. Do not hesitate to ask. Among the many symptoms that she has mentioned, acne, bloating, craving, she had a lot of mood swing, very irritable, easily angered. And she learned not to be harsh on herself and make a decision in haste. These are very good advice from a PCOS patient who is an international badminton player from India, Anushka Parikh. About a year ago, Kementerian Belia dan Sukan, or KBS, led by Yang Berbahagia Hanayo, established a women's clinic in ISN, or Institute Sukan Negara. The clinic runs weekly and open to all female athletes, coaches and staff of ISN and MSN. It is open to the public. The women clinic is run by a trained gynecologist and is equipped with a proper ultrasonography machine, and consultation can be made in full privacy. So please do not hesitate to come and meet me at my clinic in ISN for any issues related to sports or not. In the field of sports, no clinician ever need to manage a patient by themselves. We belong to a broad multidisciplinary team which must include you, me, the rehab, physiotherapists, nutritionists, psychologists, the coaches, the team physician, sport physician, orthopedics, and family and friends. Before I end my talk, please allow me another 3 more minutes to just simply attempt to raise awareness with regards to climate change. As a pediatric adolescent gynecologist, I personally feel my role as a doctor is not only to manage and treat girls and women's gynecological health. There is an urgent need to address the environment these girls are going to grow up in. I take every chance I am given to write articles and talk about climate change, and I feel all of us should. Because the heat is rising, and believe me, the rising heat will affect sports performance. Not only during summer or during hot weather like in Malaysia, it also have and will affect Winter Olympics as well. These graphs illustrate how our temperature is slowly climbing up all over our country. I live in Subang Jaya, and as you can see, there's a rise in temperature over the years, which is very worrying. These are some real photos taken in Malaysia itself. These are photos of women, young girls, baby girls, toddlers, severely affected by the effect of climate change. And if we ever think that climate will not affect athletes, we are very wrong. Climate change is an ever-increasing risk to endurance of athletes. Endurance athletes are apt to experience the effect of climate change, especially during training or competition. There must be some strategies to minimize the carbon footprint and empower athletes and sports organizations to be more responsible towards the environment. We need to change the way we live our life. We need to change the way we train. Change the way we train today before climate do it for you. There are many ways we can help. We can start separating our trash, recycling, reusing. We can always recycle our old shoes for those track and field athletes. Give ideas, for example, instead of balloons, we could give flowers, plants, switch off power when not in use. Athletes can carry their own reusable bottles and cups during competition. Practice refillable pouches for on-the-go nutrition. But most important, get educated and start educating as well. Although I personally feel that Health Talk could be a good platform for us to increase awareness about climate action, but sports has the power to be one of the most influential drivers for climate change. With that, I thank you very much for spending 40 minutes with me. I'm happy to take any questions from anyone. If you're too shy to ask, you can always WhatsApp me or send me an email. I will be very, very happy to receive any questions or any queries that you have. Thank you.
That was an insightful session, and I love how Dr. Jerilee also raised our awareness regarding of climate change with the sport. Thank you, Dr. Jerilee. And now we would love to hear from our audience. If you have any question, please drop them in the chat box and we'll be addressing them as many as possible. And for your information, actually Dr. Jerilee is in the labor room as she has a patient who is going to deliver a baby later. But she will still try her best to answer all our questions. Thank you so much, Dr. Jerilee. Okay, we have some questions in the chat box. Okay, we have one question from Farah Lee. Thank you, Dr. Jerilee, for your sharing. How can coaches respond to athletes who want to sit out for training because of period cramps? And how do we know if they are really in pain or just taking the opportunity to skip the training? I also noticed in the slide that period is normal, but the pain is not. Does cramp consider a pain or is different?
Okay, thank you, Miss Farah, for your excellent question. I hope you all can hear me. Can hear me? Okay.
Yes, we can hear you.
So I think having a little bit of discomfort and having mild pain during your menses is absolutely normal. But when you require painkillers and you take 2 types of painkillers and you start putting hot packs on your tummy until it blisters your skin, then I would categorize that to be abnormal. If you have an athlete with you who you observe and witness her trying to control her pain this way, she needs help. Now, if the question comes, how do we know whether they are sort of like giving excuses to skip training? I don't have a very long experience as a doctor in sports gynecology, but I feel that most athletes that comes to see me with or without their coaches, with or without their parents, they are into the sports. They usually want to do it. And when they come to see me, it's because they want to continue doing it. But I will be the first to admit that during my school days, I used to like put up my hand and say, I have pain and I want to skip. That's because I have no interest in that sport whatsoever. So you can get her to keep a menstrual calendar and or try to identify whether this is a real case scenario or some sort like trying to get a reason to skip. Whatever the reason the girl or the athlete gives, try to be as sensitive as possible. We don't want her to feel that we are trying to make her feel that she's coming up with an excuse. I think as long as the athletes or the students is interested in the sports, they will not want to be giving out reason for not coming for training. Will that help?
I think it's really helpful for thanks for the answer, Dr. Jerilee. And do we have any other question from the audience? If not, then I want to ask my own question.
Sure.
All right. So, I just asked this for my curiosity. Is there any real example where addressing the menstrual health significantly improves the athlete performance or their career longevity that you have encountered with?
Sorry, can you repeat that again?
Okay, so is there any real example where addressing their menstrual health significantly improve their sport performance and also increase their career longevity that you have
Okay.
encountered with?
Yes. I have seen one or two athletes which, when they first came to see me, they weren't keeping a calendar yet. And then when I explained to them, if you were to know when your menses is coming and which phase of your menses, you tend to be more alert to how much you can perform. I will be honest here, she was a wushu, I think I'll call her a fighter because she flies in the air as well. And I told her she was uncomfortable wearing her pad when she's training. And I told her, why don't you, on your first day and second day of menses, wear your pad as per usual, fly on the air, do your wushu, and see how you feel. Do that for a couple of months, and you can only do that if you know which phase of your menses. When she starts understanding how her menses behave and how her body reacts to that phase of menses, there is sense of acceptance, and therefore she will know when she will perform the best. She has got an idea as to what type of pad she's going to wear according to the duration of her menses. So I think that was excellent. I've only one or two example. I'm hoping for more athletes to come so that I could see if there is, different athletes from different fields of sports, and see how monitoring their menses can actually get them to perform even better.
Thanks for this answer and thanks for the tips to all our female athletes. I think this helped them. Hopefully they can practice like to monitor their menstruation and then to keep track, and then this can help their sport performance. And then I also have another question. So usually we know like the normal length of a cycle is around like 28 to 32 days. What if an athlete they have a long cycle, for example, for 45 to 15 days, but they show no signs like the rest or the athlete tired. So should we concern on this or it just a normal?
Okay, good question.
Mhm.
Whether or not you're an athlete or an athlete, as long as you fall under the category of adolescence, which means to say, if you got your menses, say for example, at 12 years old, and then you are currently at 16 or 17 years old, so you just had your menses 4 years ago, that means you're undergoing some pubertal changes still. You don't expect your menses to be regular at that stage. So we would accept a cycle of 45, 46, around there. If you go up to 50, it's also acceptable. My rule of thumb is that you must have your menses at least once in 3 months. So what I tell my athletes is, and I commonly do this very often so that they get an idea how important it is. If you have period once a month, I'll give you a gold medal. If you have one period in 2 months, I'll give you a silver medal. And if you have one period in 3 months, I'll give you bronze medal. But if you have one menses in 4 months, I will disqualify you. And that would like, okay, I'm going to make sure I have my menses at least once in 3 months.
Okay, understand. That's help. Yeah, but what if the athlete is like already more matured and they are over 18? Does it consider still a norm or there should?
Example, can I push the age limit maybe to about 23 years old?
Mhm.
Then I will be more stringent. So I would want a very regular menses. I still accept 3 months at the minimum list because there are other factors as well. Young women, young adolescents especially, they have their life going on. They have got school, university, they've got sports going on. So they have a lot of other external influences like stress, not enough sleep, nutrition. So I got to put all that into perspective before I start telling them, hey, there's something wrong with your reproductive tract. you know. Nevertheless, if you're much older, 23 and above, for example, I would want to investigate other causes as well. I won't take it as a whole. It could be due to lifestyle, for example. So I'll do the hormonal profile, I'll do the scan, make sure everything is normal before I tell her, something is going on.
I see. All right. Thanks, doctor, for answer my question for quite a long while. Do we have any other question from our audience? I think we don't have. And I think doctor is very busy and she's going for...
No, I'm not busy. Sorry,
all right,
sorry,
sure.
sorry.
Maybe we just open last one for our last question. Do we have any other question from the floor? Okay, we don't
Don't be
have.
shy.
Dr. Jerilee is a very experienced gynecologist. So if you have any question, even not related to athlete, like the parents, you have any gynae problem, you can also just raise up your question, or you can just type in the chat box.
Yes. Anything about gynae doesn't have to be sports.
Okay, we have one question also from Farah. Does actively training have any correlation with period cramps? Some athletes didn't have or rarely have period cramps during training, but once they stop their training, they have back cramps.
Interesting. That's very interesting. I read, I think that the same paper on swimmers, they said that more, not veteran, but more senior swimmers who have swam for a long time, they have a reduction in their pain during menses. So one theory is the fact that these swimmers actually grew out of it, and so the pain become a lot less. But I've not come across somebody who stops training and the pain comes back. On top of my thinking currently is maybe that some athletes they enjoy training, they love to do the sport they're doing, and when you stop it, it's like taking something that they enjoy, you just take that away, and therefore that would cause some sort of, again, external influences that make them feel the pain is coming back. Some swimmers have the pain, but because they're so focused on training in the pool, they don't realize they're having that discomfort that they're having. Once they get out of the pool, when everything is back to so-called reality, they can, I think I feel this pain. So I don't have a direct answer for that, but these are the things that could or could not be going on in an athlete's mind.
Thanks, Dr. Jerilee, for answering this question. Just for our audience to know, Dr. Jerilee is very experienced, like I said just now. She's also a winner of Women in Sport Innovation Award. And also she was with us for the workshop happened early this month. And this is very insightful. And I love how Dr. Jerilee explained everything in telling us a story. And also the Gisa Benar is very
Thank you.
I think we are running out of time. So our audience, if you have any question, you can just email your question to Dr. Jerilee at her email, or even just WhatsApp her, or you can just email to us and we can help you to forward the message to Dr. Jerilee and help you to answer the question. At the same time, our feedback form is also posted. Please share us your feedback regarding today's expert series. Once again, beribu-ribu terima kasih kepada Dr. Jerilee for your times and today. I'm sure each of us has gained valuable knowledge, including like how to differentiate normal and abnormal menstrual bleeding, how to identify common menstrual disorder among athletes and their clinical management, as well as the importance of multidisciplinary approach, not only doctor and not only athletes and not only coaches, but also all of us in managing the reproductive health among female athletes. If you enjoyed our today's session, we also have something special for you. For those who looking to level up your knowledge, check out our expert series and our discounted level 2 online course on our web page, where we dive deeper into practical applications of sport nutrition for different sport and condition on our website. And that's not all. Our expert series 2025 is just getting started. Next up, we are shifting our focus to tennis. On April 14, 2025, Coach Hussein from Epsom College in Malaysia will be leading a session on building a strong foundation for junior tennis player. Whether you are a coach, parent, or young athlete, or even anyone, this one is for you. So mark down your calendar and don't miss out. See you there. Furthermore, please stay connected with us and follow us on our social media like Instagram, Facebook, and WhatsApp community. Take a screenshot so that you won't miss out the latest update from us. On our social media, we're also sharing some bite-sized content on sport nutrition. You may also explore more nutrition tips for female athletes on our social media at snack.my. And we know this week is the last week of Ramadan and Raya is coming soon. We do also share some nutrition tips during Raya on our social media, so you can go have a look there. Once again, thank you so much for participating in today's expert series. And don't forget to give us your sincere feedback that will really help us to improve in our future events. Before we wrap up, a big shout out to all the females out there. Whether you are an athlete, coach, a supporter, or a doctor, keep breaking the barriers and lifting each other up. And to Dr. Jerilee and our Muslim friends, Selamat Hari Raya in advance and wishing you joy, good health, and lots of great food. See you all in the next session. Thank you, everyone.